Another cause of respiratory distress syndrome that we might see is meconium aspiration syndrome. Meconium aspiration syndrome occurs when we have a newborn who has respiratory distress that was born through meconium-stained amniotic fluid, and we don't really have another etiology to think that that caused respiratory distress. If you think about meconium, it's that baby's very first poop, so it has bile salts in it, it has vernix and epithelial cells and hair and all kinds of stuff that really isn't meant to be in the lungs. Also super thick and tarry and sticky, and so it causes respiratory distress by a lot of different things, a lot of multifactorial issues. So we can see partial to complete airway obstruction that causes collapse of the alveoli or atelectasis, and it can cause this ball valve effect where air can come in but it can't get out, and so those alveoli get bigger and bigger and bigger until eventually they burst and we have an air leak. Another problem we can see is that meconium causes this inflammatory response. So the body knows that meconium is not supposed to be in the lungs, and so there's this huge inflammatory response and this chemical pneumonitis in the lungs that causes all this inflammation and plasma proteins to basically leak into alveolar cells and cause destruction to those type 2 alveolar cells. Those are the cells that produce surfactant. Plus, the meconium itself can actually deactivate the surfactant. And when surfactant is deactivated, then we're not able to keep those alveoli open, so we get atelectasis, and it's really hard to ventilate that baby. If all that wasn't enough, we also get the fetal and neonatal hypoxemia contributes to pulmonary vasoconstriction. So we see a lot of times babies that can have pulmonary hypertension when they have meconium aspiration syndrome, and that can really complicate this syndrome. Babies have pulmonary hypertension after having meconium aspiration syndrome. They can be really, really sick, and so we can treat them with a lot of different factors. They may be treated with high frequency ventilation to provide those smaller tidal volumes and less of an air leak. We can also use inhaled nitric oxide to help with pulmonary hypertension, but some babies are so sick they actually have to go on ECMO or extracorporeal life support, ECLS, sometimes called ECMO. So those are the sickest sick babies. For my NICU nurses, have you ever taken care of a baby with meconium aspiration syndrome? Tell me about it in the comments below, and like and follow me for more NICU education.